Thank you, President. Your Excellencies, distinguished guests, it's an honor to speak to you on behalf of the global network of people living with HIV. Much has been said by my colleagues that I truly agree with. AIDS is no longer a disease, it's a human rights issue. These are words by the late South African President, Nelson Mandela. Laws that criminalize people based on their actual or perceived HIV status led to many, many deaths at the onset of the AIDS epidemic. The impact of stigma and discrimination are etched firmly in the experiences of the lives of people living with HIV that we carry to date, and for many of us, continue to be the experience of our lives. Evidence also shows that stigma, discrimination, violence, and criminalization based on actual or perceived sexual orientation and gender identity, drug use and possession, or sex work erodes human rights, advances inequalities, and stands in the way of making progress in the HIV response. The impact is stark. Many have and continue to die. Deaths from treatable and preventable diseases. I want to talk to you about how communities have been able to demonstrate that barriers to our human rights affect our access to treatment and prevention and keep us away from the global ambition of ending AIDS deaths and stopping new HIV infections. Communities collect data. We have found various ways of monitoring violations to our human rights to complement our advocacy efforts. It is why we were proud at the end of 2020, start of 2021, when our governments in their leadership secured the 10-10-10 social enabler targets in the global AIDS strategy. GNP+, the global network of people living with HIV, is the custodian of the people living with HIV stigma index since 2008, and to date, over 100 countries and over 100,000 people have been interviewed, providing critical data for decision-making by leaders globally. It initially started off as whispers in our support groups, then an attempt to document our stories of shame, vulnerability, and pain. But we wanted change, and so we documented this in the only language all decision makers would know how to use: research and data. The overall program goes beyond research. It builds communities through mobilization, capacity development, and has formed a partnership that starts multisectorally from our countries to the global level. Our global report, published in 2023, that documents data from 25 national PLHIV stigma index, has some very key data I want to share today. Of the over 30,000 people interviewed, 23.6% of all respondents had experienced HIV-related stigma in the last 12 months. For key population, it's at 35%. 13% of people living with HIV had experienced stigma while seeking health-related services, and 25% when seeking non-HIV-related care. The proportion doubles when looking at seeking non-HIV-related care. Those who had stopped care, about 34.3% indicated that restarting treatment was hampered by their fear of stigma and discrimination at healthcare settings. And because HIV is a disease of shame, over 84% said that they experienced internal stigma. This data continues to be useful in developing services that can reach even the hardest to reach populations. Unequal social structures limit access to power, resources, autonomy, safety, and rights. This is why we collect this data. And The big question that remains for communities is why there is not enough attention to community-led research and data. How can decision makers choose inaction over life-threatening facts? In the last 1 month, we have watched with dismay how community-led responses and work has been impacted, and we are back to where we have to defend it. The security of our treatment access remains uncertain now. It is critical, I must add, that if we are to achieve epidemic control, we must use the momentum that has gotten us out of an emergency of the epidemic to achieving epidemic control. And we can only achieve this if we double down efforts to end AIDS deaths and to end new infections. It is possible. It is in our collective interest to resource and use community research and evidence in the HIV response. We must be open to learn more, innovate deliberately, using various opportunities that we have now, including digital options, to gather evidence while building the capacity of communities to sustain this critical work. The People Living with HIV Stigma Index is a demonstration of a powerful community-led response that is supported multisectorally by everyone in the HIV response. As countries work on their HIV response sustainability plans, it is important that human rights promotion and protection be central to those plans. Some of them include integrating HIV services into broader health services, into primary health care, and into UHC. Now more than ever, we need rights-based approaches. Distinguished delegates, it is called the HIV response, the human immunodeficiency virus response. At the heart of why we are all here is humanity. The HIV response in our countries and globally must follow the science, or as we like to say at GNP+, follow the virus, and make visible every human affected and marginalized by this disease. Thank you very much.